Hey y'all, so this is my project on health and equity and the opioid crisis in Appalachia. The issue is two main things that I'm talking about: long-standing health inequality and widespread opiate addiction and overdose, which is a result from the decades of underinvestments within their communities and an economic collapse when the coal mining industry ended. Residents are living in remote areas without access to healthcare or specialty healthcare like mental health and substance use. Poverty is extremely prevalent, and food insecurity due to lack of resources and transportation issues. This lovely picture that I have in the bottom corner here is of a holler in Kentucky, and a lot of people still actually live this way, to be honest. This impacts the Appalachian boundaries, which are 13 total states, but for the most part, we're going to be talking about Kentucky, West Virginia, and Tennessee in this specific area. About 25 million people, 205,000 square miles. 42% of this region's population is rural compared to the 20% of the nation. And then I have these two maps here. The red map, essentially that light blue boundary is going to be those 13 states. And then starting with that dark red area, that is the most affected by the issues that I specifically am talking about. And then as it lightens up, those areas are obviously still affected, but not as intensely. And then the blue map, on the other side is the poisoning mortality rate, which is a drug overdose map, essentially. How many people are poisoning themselves, which you can see that dark blue color again is in the specific areas that I'm talking about here. It's a social justice issue because it's unfair distribution of resources and long-term neglect to the area, involving inequality of several factors, including lack of healthcare establishments, long commute times for necessary care, lack of insurance, emergency options, even basic clinics, underfunding of the community systems, schools, hospitals, and it's often ignored by policymakers and not the funds are not distributed fairly, and no future healthcare planning is usually done, unfortunately, which leads them to facing higher rates of addiction and overdose due to those things. And so for the history of Appalachia, I'm going to try to go through this really quickly because I think that it's super important to understand because this is what kind of led them to their problems. 1900s to 1950s, coal mining was the major backbone of the economic system in Appalachia. It was powering factories, railroads, and homes all across the United States. And all of these Appalachian towns were built around these major coal companies that were supplying them thousands of jobs and their health insurance and stability, essentially. After World War II, the coal mining industry took a significant decline due to other energy sources coming into play and machines replacing manual labor. That's kind of when mountaintop removals began and machines were being used. By the 1990s, mines were completely closing. People were losing jobs, healthcare, and economic support, and there were major health crises like black lung disease, disabilities, and chronic illness from working in the mines. Education was severely suffering because kids were leaving school to help support their family and put food on the table. And then the communities never really invested in education after the coal mining. Which led to long-term poverty and health inequality. So, for example, in 2024, they did a study, and 6 out of 10 people living in this area in Appalachian, Virginia, could only read at an eighth grade reading level or below. So that's 61% of people in this area that could only read at a max of an eighth grade reading level. So low literacy rates lead to things like not being able to understand healthcare and prescription access, and that makes it a lot more difficult. Um, Obviously, making them a vulnerable population. Purdue Pharma started marketing Appalachia with OxyContin in the early 1990s. By 2000, OxyContin was being prescribed 5 to 6 more times within that area than it was in the national rate. 34,000 free starter coupons were redeemed before this program ended in 2001. So they were giving out coupons for free OxyContin from 7 to 30 days worth of OxyContin to the people in this specific area. And 34,000 of those coupons had been given out by 2001. Eventually, Purdue Pharma and the Sackler family suffered lawsuits and filed bankruptcy in 2009, but some of the families were rewarded in settlements, but the communities didn't receive any type of direct relief and or change. and the overdose rates still remain high. So the social work roles in this area, I just kind of broke it down here. Micro level therapists, counselors, case managers, advocates, trauma informed healthcare, substance use issues, identifying co occurring mental health, connecting clients with services such as housing, transportation and food. And then medication assisted treatment is huge, MAT intervention, and harm reduction. And then at the meso level, you have hospitals, clinic-based social workers, school social workers, community outreach, providing education and training within the communities on addiction and stigma, support groups, building partnerships with faith-based or local groups for community outreach, conducting prevention and education programs, which is extremely important in these types of communities because they don't really get any of that, and reducing stigma and positive attitude changes for health and recovery. And then at the macro, you have policy advocates, lobbyists, public health social workers, advocating for equal health access and Medicaid expansion, which hopefully will still continue, and systematic changes in pharmaceutical accountability and prescribing practices, which is extremely important. Conducting rural health disparities and needs assessments, all of those types of things are very prominent at the macro level. In this little graph here, I have this light blue color is going to be the percent of persons in rural Appalachia that is living in poverty, and the dark blue color are the percent of persons living in poverty in rural America, but not within the Appalachian community. So you can get a little bit of a picture. Social work values, I could have chosen several social work values, but I went with service and dignity and worth of the person because service, you're working directly on the front lines with people being affected every single day. You're showing up consistently when resources are limited, and you're helping them with complex systems like healthcare, criminal justice, and child welfare. You're going beyond individual care to set up prevention and outreach education to help with future changes, which is what these communities really need. And then the dignity and worth of the person is extremely important because there are so many stigmas and cultural dynamics to the way people look at these groups. You need to come in with cultural competency. You need to understand their cultural values and meet them where they are. You need to help them build rapport and trust you because they have been taken advantage of for a long time. So I think that these are two of the most important values. Students should know that this is a health and justice issue that impacts a lot of the country, but specifically this area. It started with the coal mining industry and kind of predestined people to live how they live. They were specifically targeted by the pharmaceutical companies, and stigma is a huge barrier to break in order to accurately help these people in need. We also need to acknowledge how displaced and remote a lot of these communities are. We need to educate others about rural health care, support harm reduction, advocate for policy changes, and donate your time and resources to people in need. And then social workers, cultural competence, as I talked about before, is extremely important because of religious values and pride and self-reliance. Determining factors based on health and social norms. Social workers in rural communities are focusing their practices specifically on learning about these communities and addiction recovery, substance use, and harm reduction. And then educating others, advocating for policy changes yet again, and then learning practical skills in MAT training and prevention strategies. A lot of the community is sending social workers from master's programs and things like that. They're giving them they're giving them stipends, they're giving them specific education courses in order to learn how to navigate these very delicate systems within this community. So, for example, in 2023, they did Appalachian Saves a Day. So once Narcan was approved by the FDA, faith and public-based outreach communities of the social work network handed out 30,000 doses of Narcan amongst those 13 states that I originally talked about. And then they also just do different types of prevention. They're giving out scholarships for college kids to learn about the area, to learn about how to do opiate prevention and things like this. They're trying to focus on these specific instances and advocate for policy change, essentially. Several resources here for change. Appalachian Voices is something that focuses on environmental issues if you're into mountaintop removal and you care about the environment. Shatterproof is something that talks about reversing the addiction crisis across the entire United States. Super interesting and great resources if you want to help out. Over the Hills and Through the Hollers is something about an opioid epidemic. The University of Kentucky is doing a bunch of research and giving out grants and whatnot to social workers essentially to help with the cause. Americans Helping Americans is one of my favorite ones because it's super easy to do. You could donate $10, and what they do is essentially fill a backpack for a kid so they can go to school and have books and pencils and all of that stuff. So that's a very basic thing you can do to help. And then the Appalachian Children's Coalition is just Children's Hospital helping with funding and stuff like that. For children's mental health and behavioral resources. And then for me personally, turning my awareness into an impact, I would love to use my psychology background, understand trauma, addiction, and poverty, and how it impacts mental and physical health, and then build on that with a social work background and ethics and intervention and how to advocate for people. And then learning how to just be a part of and stay engaged with local communities that align with my values. And my most important thing is educating others through conversation and research, just like this project, to help raise awareness to issues. And so, yeah, that's my project. Here's a couple of pictures. This picture is super funny of the kids on the left. It's from 2007, and this is another holler, and you can see a house here, and that's how a lot of people still live to this day in this area. And then from 1938, this is a picture of the coal miners in West Virginia and how they were brought into the coal mines, so you can kind of get an idea. But yeah, looking forward to hearing about your guys' projects.